how it will support vaccine access, equitable vaccine access in Washington state. On the line, we have our speakers for today, Washington Governor Jay Inslee, King County Executive Dow Constantine, Seattle Mayor Jenny Durkan, Seattle Foundation President and CEO Tony Mestres, Jesus Fernandez, CEO of Family Health Centers, Susan Balas, co-founder and executive director of Na'a Ilahi Fund, Lilian Valdez, executive director of the Latino Community Fund, and Reverend Walter Kendrick, pastor of Morning Star Baptist Church. The briefing is going to consist of these 8 speakers, who will each speak for approximately 5 minutes until about 12:35 or 12:40, when I will pass it on to Anthony Derrick of the Seattle Mayor's office, who will be running our Q&A. If you didn't get your question in via our RSVP system on the advisory, you can put your name and affiliation in the chat box for when we get to the Q&A. And once again, I just want to thank both our speakers and our media participants for being with us today. So I'd like to introduce our first speaker, Tony Mestres, CEO of Seattle Foundation, who will be kicking us off with his remarks and introducing Governor Inslee. Welcome, Tony, and thank you for joining us.
Thank you, Artie, and thank you all for joining us today as we launch the Vaccine Equity Initiative. Let me begin by saying that Seattle Foundation is really so honored to play a role in standing up and supporting All in Washington, which has been an unprecedented, coordinated statewide COVID relief effort. It's included over 50 cause and community funds across the state. Together, they came together to help local communities, and we have collectively raised more than $100 million with so much more to do. Thanks to generous Washingtonians everywhere, we surpassed our initial goal of $65 million last year and have mobilized critical funds around childcare, digital equity, basic needs such as food and housing. All in Washington works with our government partners to focus philanthropic giving to fill gaps not covered by public funding. And today our work continues as we take the next step in COVID-19 recovery to expand vaccine access in our hardest hit communities. Systemic disparities have made it harder for many communities to stay healthy and safe throughout the pandemic, especially Black, Indigenous, and people of color, immigrants and refugees, and rural and remote communities. Just as we saw the pandemic and economic crisis disproportionately impact these communities, we're also seeing some of the same disparities play out in terms of vaccine distribution across our state. All Washingtonians must have equitable access to vaccine, and now is the time we address these inequities. That's why we're launching the Vaccine Equity Initiative to direct funds to community-based organizations best equipped to meet the needs of impacted communities on the ground. This initiative will provide funds to organizations to assist with outreach and education to communities most impacted by these disparities: the elderly, rural and remote communities, immigrants and refugees, and communities of color across our state. You'll learn more throughout this press conference about where funds will be targeted to help ensure all Washingtonians have equitable access to the vaccine. All in Washington has been guided by the expertise and leadership of a community advisory group, and some of those community partners are on the call with us today. You'll hear from them on the needs they're seeing across the state and ways this fund will provide aid in this critical time. I want to thank them sincerely for joining us today and for all the work they're doing. Thanks to the generous support of donors, partners, partnership with our elected leaders, and expertise with community leaders, All in Washington has been able to redirect resources quickly to communities and local organizations best positioned to help during this crisis. The Vaccine Equity Initiative will work to shape the next step of our state's recovery. We have a goal of raising $15 million, which will complement the anticipated commitment of public funds for education and outreach. And we're grateful for the early support of the Starbucks Foundation and Primera Blue Cross, who've already made generous commitments to the Vaccine Equity Initiative. We're also grateful for the support of our leaders and honored to have Governor Inslee with us today to speak more to why we must come together around this important issue. Governor, thank you very much, and I'll pass it over to you for your comments.
Thank you very much for everybody involved in All in Washington. This is a way to advance the arc of the moral universe by having more equity and justice in our vaccine program. We're very ambitious in this program, and we are moving the needle big time. We're over 1 million doses. Now we want to have as much equity as humanly possible in the administration of these doses. My principal role here today is to assure people who might want to participate in this noble effort, to let you know the state's going to be a great partner and is being a great partner in this effort to bring equity to the vaccine administration program. The state is in it, and we will be a great partner with this philanthropic effort. Both fists, if you will, in the cause of justice are important here. And so my role is to just describe what the state can do in partnership with this All in Washington effort. I think there's two things that we all recognize to bring more equity to the vaccine program. It's two parts. Number one, to help people have a desire to get the vaccine. This is obviously the first step because people need to want the vaccine before they're going to get the vaccine. We're not going to be drafting people into this effort. We have a large role to play in that. And second, to provide people meaningful access in real terms, where they live, how they live, with their functionality in a way to get access. I just want to briefly talk about what the state will do to be supportive as a partner to this effort. First, on the issue of information and desire, we know that there is reluctance in some of our communities, more reluctance than others, to get the vaccine. And our job is to provide people with as much as information as they desire to be able to make an individual decision. And I want people to know that we're going to be a good partner with All in Washington in this regard. We have already made very significant efforts that will continue. We've spent in the last few months and in the next couple of months about $4 million in outreach efforts targeted to BIPOC communities where they live in the language. This is in about 32 different languages that the state is providing vaccine information. And we have funded another $11 million in the months to come in that effort. And just to give you a flavor of what this looks like, we have tried to be as accessible as possible. Just to mention some of the groups we've worked with: the NAACP in Vancouver, the Islamic Center of Tri-Cities, the Refugee Immigrant Services Northwest, the ARC of King County. We've used our outreach system to get people where they live. So we've worked with the Black Lens, Hawaii Radio Connection, Radio Cadena, one of my favorites in Central Washington, La Voz in newspaper, and Runta the Truth. So just as an example of several dozen groups we're working with to try to get the information out, and we will continue that effort. That really is the first part of this effort, but the second is access. We have to provide people real access in a meaningful way. I'll just mention some of the things we're doing. We're increasing our allocation to clinics that are more accessible for the BIPOC communities. We've significantly ramped up the allocation. About 20% of the entire state allocation is now going to community and immigrant healthcare providers. That's gone up significantly in the last couple of weeks. We're also using some good techniques in our pop-up clinics. I mentioned we're working with the Wenatchee Cafe group to provide the ability to make appointments on the telephone because we know some people don't have the computer access that we would like. And I want to give a shout out to Mayor Durkan, who has pioneered some of these efforts. Her fire department's done some great outreach efforts, and I know Executive Constantine has done the same thing on a county level. So we've got to be creative in this regard. I think we should be optimistic to be able to move the needle here. And the reason is we have already demonstrated some success. I'll give you an example of that. In the Black community represents about 2.1% of the population over 65, but it represents about 2.7% of those who have received vaccines. We've had some success with these equity initiatives. In the Hispanic community represents about 3.6% of the state's eligible population. So the people who are currently eligible in the Hispanic population, about 3.6%, they have received about 2.5% of the doses. Not perfect, but we're on our way. And we want to make this as equitable as humanly possible. So I want to thank everybody working on this. I want to tell you the state's going to be there arm in arm with you. We got more work to do. We've had some success, and I'm looking forward to everybody helping pull on the rope here. Thanks a lot.
Thank you so much, Governor Inslee. Our next speaker is Jesus Fernandez, CEO of Family Health Centers in Okanogan County. Welcome, Jesus, and thank you for joining us today.
Thank you for the opportunity. On behalf of Community Health Centers, we also are grateful for and appreciate the generosity of so many people that are helping contribute to the solution of reducing disparities. As the governor identified, we are seeing disturbing disparities among under-resourced populations. Similarly, we saw disparities in terms of reaching people with testing earlier. So we are concerned about the disparities continued with the vaccination efforts. Some of the barriers that are contributing to these disparities that we need to address are things like transportation, online access, language barriers, and frankly, addressing the fear that exists among communities because of either misinformation on social media or just lack of access to correct information. So anything we can do to address those barriers and help people access vaccination opportunities. The mass vaccination events that we have are excellent, are a great way to get us to that minimum 70% of people being vaccinated to achieve some minimal levels of herd immunity. But it's not reaching the people who can't go online and register, or they don't have the transportation to get to these mass vaccination events. So a way to address those things is building capacity across systems and partners that allows us to reach these populations where they live, where they work, where they come together, such as churches and other locations. So anything we can do to direct resources to those efforts will certainly help. Leveraging trusted messengers from the respective communities is an important component. A lot of health systems are hiring community health workers from these communities because they can tap into those informal networks of individuals in their community that are trusted voices that can help address the lack of information or the inaccurate information that may be out there. So another of the tools that are being used is mobile clinics that can go to where the people are. But a lot of the bottlenecks also happen just in the pre-registration to these events. As you know, vaccination is more complicated than just testing. We have 2 doses to deliver, so you have to have a lot of very accurate registration ahead of time, a lot of coordination and planning. And those things tend to happen prior to an event, prior to actually going to where the people are. And that's where a lot of community-based organizations like CAFE that was mentioned by the governor can help health systems who are the ones actually doing the vaccinations. So those are just some of the insights that I would share. Another concern that we have is that, especially among some rural agricultural communities, there's been historically a reliance and a tradition of relying on home remedies to address health issues and doing self-care. While that is normally a good thing, this is not enough to address this virus that we are facing. And so we need to help those folks understand that they can't rely on those kinds of self-health, self-care issues or practices when you're trying to fight this virus. We need actual health systems who have the science to address it correctly.
Thank you, Jesus. Our next speaker is Seattle Mayor Jenny Durkan. Welcome, Mayor. Thank you for joining us.
Thank you very much, Artie. And I want to thank the governor and the county executive, Dow Constantine, for their partnership and leadership. We're not quite a year into this pandemic crisis, and I could not ask for better partners and leadership the whole way through. And also my thanks to all the community-based organizations on this call, but across Seattle, the county, and the state, who have really been true partners throughout this. I want to thank all in Washington for recognizing how important this next phase is and how important it's going to be to get equitable vaccinations distributed. The work they've done already together, this private-public partnership, has been really shown the best of Washington State and Seattle, and I'm really thankful for them looking at this. At the city, we are very committed to ensuring that our BIPOC communities have, and our immigrant and refugee communities have, equitable access to vaccines. The stakes of this work couldn't be higher. We know that over 475,000 Americans have died of COVID since the pandemic began. And as you know, the pandemic is disproportionately hitting our BIPOC communities, our immigrants and refugees, and our elders. In our region, the impacts on the Black community, the Indigenous community, and Latinx community is truly disproportionate. And many BIPOC and immigrant and refugee community members face already so many systemic barriers to vaccine access: mobility barriers, language barriers, not being connected with the healthcare system, maybe being underinsured, and having a distrust of the medical system. The fact of the matter is, COVID-19 pandemic has hit these communities the hardest. And if we want to advance the next stage, we have to make sure that those communities have access to our vaccine efforts. The City of Seattle is working to vaccinate as many of our vulnerable community members as we can. We get about 1,000 doses a week, and as the governor knows, I'm begging for more all the time, advocating, but everyone is extremely limited right now. So we went by way of having our fire department create mobile clinics, and we've already vaccinated over 4,300 vulnerable Seattle residents through that program in 86 adult family homes, 28 affordable housings with seniors, and 6 community pop-ups. And I'm really proud to date that in those efforts, 75% of those we vaccinated are from our BIPOC communities. That shows we can do both. We can have an efficient vaccination program, and with intention, we can make sure that it's equitable. At the city, we've done this by working hand in hand with our community-based organizations. They are the trusted messengers, as you heard Jesus say. They're the ones that have access into the communities and can make sure that we get the right people. Part of our model is they bring the people to the pop-up clinics, and we'll bring the vaccine. They make sure they get the most vulnerable and eligible people, but in this way, we've really been able to move the needle. And some of these clinics are truly a joyous occasion where people who've been fearful, who didn't have access to healthcare, where COVID has been such a burden on them, have shown up together, and they see community together taking that step towards vaccination and making sure that we can beat this virus. For this to happen, we have to invest deeply into the communities who need this. And that's why this fund is so important. And again, I want to thank everyone who has generously given, and all in Washington who provided this as the next phase of giving back to the community, because we know we can't reopen, we can't recover until we get to that 70% number. If we want to make sure that our BIPOC communities are included and a part of this efforts, this is going to be so critical. So I want to thank everyone for this. And again, particularly thankful for my partnership over this last year to the governor and Dow Constantine. At each step of the way, they have been really looking at how we can pull together as a community to first bend the curve, and now we're going to beat the virus. Thanks so much.
Thank you so much, Mayor Durkan. Our next speaker is Susan Balas, co-founder and executive director of the Na'a Fund. Welcome, Susan, and thank you for joining us today.
Thank you, Artie, and thank you, everybody, for your wonderful words. And I, too, am very happy and encouraged by what's happening in our state. Indian country's been hit very, very hard, as I think many of you know. And I think that the tribal clinics have been doing a good job with the vaccine so far. And I really want to highlight the work of Seattle Indian Health Board, where I had my vaccine this past week, had my second one. So very thankful for that. But we can do a lot better. And I'm very excited about this fund because a lot of the barriers that we're experiencing in Indian country are the ones that Jesus was talking about. And I believe with this fund, we can get trusted messengers out there. We can do mobile clinics. We can help to get folks to vaccine sites. And the Urban Indian Health Institute did a survey that was released, I think, a few weeks back, And it really highlighted the fact that the majority of Native people are very committed to protecting themselves, their families, their communities by getting vaccinated, but are experiencing those barriers. So with the help of Philanthropy, all in Washington, and a lot of great collaboration with government, I feel like we are going to do it. We're going to beat this virus. So thank you so much.
Thank you, Susan. Our next speaker is Lilian Valdez, Executive Director of the Latino Community Fund. Welcome, Lilian, and thank you for joining us today.
Thank you, Artie. Thank you, everyone, for your words. And I want to say a big thank you to all the local leaders who I know are doing a lot of outreach work every day in our communities and are really supporting our families. I'm honored today to be speaking on behalf of the All in Washington Fund Advisory Group. The group, we are comprised of 24 people, and we represent many communities across our state, from Black, Indigenous, people of color, our rural and remote communities. We've got leaders from Seattle to Spokane, from Yakima to Bellingham to the Tri-Cities. And we're a partnership of community organizations, that companies, foundations, public entities, and really when COVID was coming out, we came together with the common cause of mobilizing urgent support to communities who we see are hit hardest by the pandemic. And so I'm excited to be here with everyone and to be announcing the Vaccine Equity Initiative, which, as you've heard, will direct funding to trusted and known community-based organizations who can, and we know who already are, leading vaccine outreach. They're already doing education in our communities. They're already providing access in the hardest hit communities of Washington state. And with the partnership that's happened here with All in Washington, we feel this is a great, uniquely positioned place to host this effort, because we're able to streamline resources to the trusted and known organizations so they can continue doing this work, continue leading outreach, continue providing education, and continue expanding access on the ground. We know that it's those community-based organizations and those trusted messengers, as have been mentioned, those promotoras who are working directly with families, and we want to invest further there. In the last 6 months, the All in Washington group has administered 4 grant cycles with the focus on childcare, on youth behavioral health, and of course on emergency flexible financial assistance. We're hearing from community that's the need, and that's where the resources are being invested. And through that, we've awarded more than $12 million to communities who are most impacted across Washington state. And we see this as part of our work. We received applications from over 500 incredible organizations representing every county in Washington. And we know that this just shows how much need that there continues to be across the state and how long recovery might actually take. For the group, among the organizations we funded, the majority were BIPOC led, they were BIPOC serving, they're in community. And like with all its efforts, this initiative will utilize our collective capacity, our statewide network of community partners, and various channels of communications to raise awareness and direct support to organizations best equipped to help on the ground. As the governor called out, a group like Café in Wenatchee area, to our local radio stations. So the All in Washington Advisory Group's decision-making is going to be guided by where there is greatest need, with particular attention to BIPOC-led and community-rooted organizations, to rural and remote communities where there's limited access to resources and to services. For the Vaccine Equity Fund, we are drawing inspiration from the successful census outreach work that just happened in 2020, the models across our state, which demonstrated the effectiveness of investing and continuing to invest in trusted and known community-based organizations, in those leaders to mobilize their communities. We know that those leaders are most in tune with the needs of our communities, and that they carry out the critical education and outreach work in ways that are culturally and linguistically specific. So specifically, the goal on this initiative is to raise $15 million to match government dollars around vaccine outreach and education. And this is going to be a combined total of $30 million of public and private investment. And as we move forward, It's critical, we know, that we work together to expand equitable vaccine access to communities who continue to face the devastating consequences of this pandemic and are just continuing to face it, families every day. It's even more critical when we factor in the long existing inequities that have made it harder for communities of color, for our Native communities, for our rural communities to stay safe and healthy, especially now. So that's why now is the time to address these inequities. Now is the time to mobilize our collective resources quickly to those in need and those best positioned to help them. The Vaccine Equity Initiative is, we think, a critical step forward for recovery. And while the path to recovery for our state will be a long one, we know it will be shaped by the actions that we are taking together as a collective. So thank you so much for this.
Thank you, Lilian. Our next speaker is King County Executive Dow Constantine. Welcome, and thank you for joining us today.
Well, thank you, Artie, and thanks to the team from All in Washington for gathering this group here today. Thank you for your efforts on behalf of everyone in our state. You know, throughout the pandemic, communities of color have borne the brunt of the disease. And we've seen this across the country, and we've seen it across our county, across King County as well. Identifying and solving systemic racism is not only about the criminal legal system, though it is that. The racism and bias is ingrained in every system in our society, public and private, and that includes the healthcare system, as this pandemic has really highlighted for many. In this moment of challenge, I am tremendously proud of what Public Health Seattle and King County has achieved in partnering with communities in King County, and I'm grateful for the effort of All in Washington's Vaccine Equity Fund to expand this work in King County and across the state. In distributing the vaccine, our public health teams are working to ensure that some of the most at-risk people in our community are getting access to the vaccine. 2 weeks ago today, I opened King County Public Health's first two high-volume clinics, emphasizing older adults over 75 and in some of the most diverse and highest COVID activity regions in the county. Because of the efforts of public health, working with trusted community partners to find trusted messengers and supporting language outreach, we've filled every available appointment at those sites. And within those appointments, 43% of those vaccinated at our sites identify as Black, Indigenous, or people of color, which is more than double the proportion of people in that age and race demographic countywide. That kind of partnership, that kind of result is exactly how we can succeed in saving lives and getting everyone vaccinated and in defeating this pandemic. And I'm very thankful to have the Vaccine Equity Fund to help align resources and ensure that public health organizations can work directly with the communities they serve all across the state of Washington. Thank you.
Thank you, King County Executive Constantine. I'd like to welcome our final speaker, Reverend Walter Kendricks of Morning Star Baptist Church. Welcome, Reverend, and thank you for joining us today.
Hey, thanks for having me. Good afternoon to everyone. I am Walter Kendricks. I have the extreme honor of being a pastor of Morning Star Missionary Baptist Church on the other side of the mountain here in Spokane, very, very snowy Spokane. I'm grateful to be here. You know, if the state of Washington has proven anything, it's that we're resilient, we're strong, we're better together, and we're determined. And so we're trying our best, all of us together, to uplift our neighbors so that we can come out of this pandemic and the racial reckoning stronger and better than we've ever been before. We understand that this recovery is going to be a long road, especially for our hardest hit communities, which is the BIPOC community and the Black community in particular, along with our Native brothers and sisters. But these vacancies, and these vaccines are the first sign to recovery, and I'm very, very encouraged. We've got to make sure that everyone is part of this recovery, including all those groups that I mentioned. We believe that this vaccine is the light at the end of this long tunnel that we've been in for so many months. So very, very grateful to the leadership that Governor Inslee has provided. So very, very grateful for the All in Washington Fund that has reached out and saw the need and reached out to so many of the communities that are the hardest hit. I'm just so grateful, so very, very thankful that these things have occurred. We've got to work together. And with this group that's formed here, All in Washington, the state, local city governments, counties, so forth and so on, if we work together collectively, we can ensure that we will come out of this better, stronger, greater than we've ever been before. So the Ministerial Fellowship here in Spokane, we started working on this 2 weeks ago. The message I spoke yesterday from the pulpit at Morning Star concerning the need for, our history is we're somewhat leery of the healthcare apparatus in this nation, but we have to get this vaccine. And so the Ministerial Fellowship of Spokane has been pushing this message. We are just so grateful again. Thank you for having me this morning.
Thank you so much. And I want to thank, again, all of our speakers for their remarks today and for joining us today. I'm now going to pass it off to Anthony Derrick in Mayor Durkan's office, who's going to be running the Q&A portion of our program. So over to you, Anthony, and thank you.
Thank you very much, Artie, and thank you to everyone for your words today. So for anyone who is joining us now who has not yet been a part of one of these WebEx Q&A sessions, this is how it will go. I will read your name off. I will open up your microphone line. You will ask your question. I will place you back on mute, and someone will answer your question. For folks who have not RSVP'd in advance, we are asking that if you would like to ask a question, please write your name and the outlet that you represent into the chat. Send me a quick message and we will add you into the queue. Due to the number of people who are in the queue and the number of people joining us today, we will be only taking one question per reporter per outlet. So just keep that in mind when you ask your question. And without any further ado, I will hand it off to Ariel Dreher, I hope I said that right, from the Spokesman Review. Ariel, the floor is yours.
Great, thank you. Can you hear me?
We can.
Great. I'm curious how funds will be equitably distributed out to community groups statewide, particularly in rural regions or communities that don't have access to healthcare systems. Is data going to be used? Are groups that haven't received funds yet this pandemic going to be targeted? If some of those distinct measures could be talked about, that would be great. Thank you.
Hey, Ariel, I think, thank you for the question. I think I'll take it. I'm from Spokane, and since you're from the Spokesman Review, I'll answer it. This is Pastor Kendrick. Funding trusted groups in the rural, remote, and the tribal communities, it's been a basic principle, a core principle of All in Washington from the start. The majority of the $12 million that they've already awarded has been to support organizations from local communities across the state that face the largest and the greatest barriers for services and that have fewer resources to support vulnerable workers and so forth and so on, families. So, and the same principles and priorities that we've used before, the All in Washington Fund shall be using as far as the COVID vaccine relief effort.
Thank you, Ariel, and thank you, Pastor Kendricks. Our next question today will come from Pablo Gaviria from Univision Seattle. Pablo, the floor is yours.
Thank you very much. Question for Governor Inslee or anyone who may have the answer. You mentioned vaccine hesitancy in BIPOC communities, but according to census data, the percentage of individuals who express hesitancy in the white population in our state is almost twice as high than in the Black population, also higher than in the Hispanic population. So my question is, what methodology are you using to identify where the bottleneck is in vaccination for the Hispanic population?
We would like to reduce hesitancy based on false information to the extent of any community. I'd be interested in some of the numbers you're citing because they're certainly different than some of the ones that we have seen. But this is, in the BIPOC community, they've had so many barriers to access to healthcare. I believe they certainly deserve a rational and fair amount of information so that they can make decisions. So I'm not sure that your numbers are the ones we're looking at, because we have seen a historical reluctance based on the Tuskegee experience, certainly in the Black community, and I think the pastor made some reference to that. So we think this is a community that deserves to get straight, honest, scientifically accurate information so that they can make decisions. So we do believe targeting these populations to make sure they do have access to that is critical. And we have done that. We're doing that in 32 different languages, I've indicated. But I also want to say that this needs to be teamed with access. It's not just enough to give information. You have to give access. So, for instance, when we set up our max vaccination sites, 3 of them out of the 4 we set up in Eastern Washington to give more access to areas with a larger Hispanic population that has been so heavily hit with a higher rate of infections than the general population. And we're doing things to give them the ability to make reservations. So 20% of all the appointments now are reserved to be done by telephone so that the folks who don't have computer access can get access. So I believe both are necessary, and we will remain committed to this along with this philanthropic group.
Thank you, Pablo, and thank you, Governor. Our next question will come from Patrick Quinn, Como. Patrick, the floor is yours.
Hey, Governor, this question's probably for you, but anyone really can chime in. In talking with some Hispanic and Latinx community leaders this morning and over the weekend, they're encouraged by the older population getting vaccinated, but for them, it's really about the essential workers. We know a huge proportion of Latino and Hispanic population, they are essential workers. So is this a start in building that framework so that when we do move to that phase, is there any chance that essential workers within the Hispanic population could be prioritized a little higher?
They are, and this is very important. The next tranche, the next phase, essentially are essential workers. And importantly, that includes those who provide us food to eat. People in food processing facilities, grocery clerks, those in the agricultural industry. This is very important in general to the public who like to eat, which is mostly everybody I know, but also particularly to the Hispanic community that has been so pivotal in the maintenance of our agricultural industry. So they will be in the essential industry category, and they will not be bumped for other essential workers. Look, there are other groups that, everybody wants the vaccine, but we're not going to put them in a subordinate position to other essential workers. We're not going to put them in a subordinate position to bus drivers or a subordinate position to childcare workers or a subordinate position to educators. Those folks feed us, and they have been, they're about 30% of the infections, even when they're about 13% of the population. I also want to make clear why we're so committed to this effort. As I indicated, we have had some relative success to date. 3.6% of the population of the folks who are now eligible are Hispanic, and we're not that far off. We're about 2.5% of those who have received the vaccine. Similar relative success for the Black community. But as we move into the younger community and the essential workers, we will have much more work to do to provide access to larger numbers of people. That's why we're so committed in the state to be a good partner with all in Washington to get this work done.
Thank you for the question, Patrick, and thank you, Governor. Our next question will come from Essex Porter, Cairo 7. Essex, the floor is yours.
Yes, a question for the county executive and the governor. Why is philanthropy needed for this? Shouldn't this be a core function of the state and local government? And for Susan Balas, there's criticism of the DOH data practices from the Urban Indian Health Institute, saying that many Native people are mischaracterized as Hispanic. What is your concern about that and the ability to reach people who truly need to be reached?
Well, Governor, if I may. Thanks, Essex. This is Dow Constantine. The reason that philanthropy is needed is because fundamentally public health is underfunded, and they are stretched mighty thin right now. And the reason that public health and many other public works are underfunded is because the state has an anachronistic and unfair tax system that is not well tailored to the modern economy. So fix the tax system and you fix a lot of these other problems. We are very grateful for All in Washington stepping up to help fill the gaps left by our failure over decades to adapt our tax system to modern circumstances. But it should also be a signal to us that we could do much better if we stepped up to that overarching challenge and made sure that essential functions like public health were funded for the kinds of challenges we're facing right now.
I would just add one comment that there isn't anything wrong. This is a core function of government. That's why we're fulfilling it. And we're having a base layer of something we are all contributing. But there's nothing wrong with giving a vehicle to those who would contribute a bit more because they believe in the cause of social justice. They might have been inspired by the poet laureate at President Biden's inauguration. They may think about John Lewis and his legacy. And there's nothing wrong with that, those folks having a vehicle to help out. That's what we're doing here.
Thank you, County Executive, and thank you, Governor. Yes?
On the data issue for Native Americans, that's an ongoing issue. It's been very problematic over time. We're working very hard to address data reporting so that it can improve. And I thank the Urban Indian Health Institute for really highlighting some of the issues that have been going on for basically hundreds of years. And so, coming in at just under 2% of the population, we're not really sure how accurate that is. And across the board in reporting, when we have better kind of pathways to report that aren't asking questions that kind of put you in a box, not the box you want to be in, we can do a lot better. And so that affects us across the board and continues to do so, but we're working on it. So thank you for asking that question.
I would like to add a couple comments on regarding the questions on serving and reaching the Latino community. There are two concerns that we have. Community health centers across the state have been preparing to reach populations with the vaccine, but we have a concern that we are seeing inconsistent allocation and distribution of the vaccine. So we're hopeful that that can be addressed. The other concern that we see is that while many Latinos are enthusiastically accepting the vaccine, there are indications that we have a number of certain populations among the Latino community, especially folks who come from very rural areas of Mexico and Latin America, where their folks have been very resourceful for years, for decades, in terms of self-care, because they often come from places where there's no systemic health care. And so those folks may tend to rely on those healthcare practices that are just inadequate to fight this virus. And so we need to help them understand and not be and be more accepting of this solution and this protection against the virus. For example, we've had some folks from my area who have had their relatives who've gotten the virus travel all the way to Mexico because they think that they can get care over there that is more trustworthy than here, and that's a big concern for us. So we need to address a lot of the misinformation that we see on social media and mitigate the fears that people may be having around the vaccine. Thank you.
Thank you, everyone, and thank you for answering those questions so thoroughly. Just as a reminder to our press, we have about 15 minutes left in our run of show, and only 2 folks left in the question asking queue. So if you would like to get a question, please go ahead and drop it into the chat. Otherwise, I'm sure everyone would be happy to get a few minutes of their day back. Our next question will come from Deborah Horn, Cairo 7. Deborah, the floor is yours.
So much, and thank you everybody for talking to us on this holiday. Governor, we need to ask this question though. You know, we got a notice last week from the Department of Health saying that first doses are going to have to be rescheduled because the second dose of vaccines are not available. So we want to know, how could this have happened? And is this the result of these entities trying to meet your demand of giving out 95% of vaccines so that people who have scheduled, and you know the agony, if you don't know it, I know the agony people have endured to get a vaccine. What are they to do now if they can't get the first dose that they have been working for oh so long to get? And how did we get in this fix?
Well, we're in this fix because there's 1.7 million people who are eligible for the vaccine, and we're getting about 100, maybe 15 or 20,000 doses a week. That's why we're in this difficult situation. I heard somebody in the radio this morning say, why doesn't the National Guard just go, door to door and hand out the vaccine? Look, the problem is there's not enough vaccine. This is the fundamental problem that everyone is up against. There is tremendous frustration in our community because of that, and that's entirely understandable. Fortunately, we have an administration that is helping increasing the supply of the vaccine, both in its gross amount, and as you may have heard, the president has signed a contract for an additional over 100 million additional doses. In addition, he has told us, the administration, that they will give us a more predictable supply. But because our supply has not been predictable, people have sometimes used what should have been second doses, and they use them for first doses when they should have used them for second doses. If they had used them for second doses, we would not have to this week use our allocation for second doses that are obviously necessary. So the fact of the matter is, people, because they did not have a certainty of supply, used their second doses as first doses, therefore they were not available for them. And obviously we had to fill in that vacuum because they were used as first doses. They could have used them for second doses, but they did not do so. And that was regrettable, frankly. But we have improved this process dramatically. I'm very happy. We've now done over 1 million doses. Our acceleration rate, we're now about 14th or 15th in the nation as far as percentages, and we are making improvements all the time. So I hope that we will continue to work together on this, and the more doses we get, the more we can get into people's arms.
Thank you, Governor, and thank you to everyone who has chimed in the chat. We have a handful more people to get to, so thank you all. Our next question comes from Scott Green. Oh, sorry, go ahead.
Yeah, I'm sorry, Deborah. I wanted to fully answer Deborah's question. It is important that we give the doses in a timely fashion. What we found early in this process is some folks were kind of hoarding this vaccine and not getting it into people's arms. We just can't have this. This is a life-saving vaccine. We need to get it into people's arms. So we did impose a requirement that we get that into arms. As a result, we rose from 32nd in the United States as a percentage of vaccines that were administered to 14th or 15th now. That is a very significant improvement. And that to do that, it necessitated some of our actions so that we can actually get people vaccinated. But I am confident that as we get a more stable supply, as these providers get a more predictable situation, this is going to be avoided in the future.
Thank you, Governor. Our next question will come from Scott Greenstone, Seattle Times. Scott, the floor is yours.
Thank you all so much for spending your President's Day with us. This question is also for Governor Inslee. It's a follow-up about the vaccines and the chaos with the rollout. Yesterday, the Seattle Times published a story about how in the early phases of the vaccine plan, we didn't enlist the National Guard in centralized vaccine appointments or give providers a strategy to process patients, and we had to play catch up. And then, despite a constrained federal supply, the state opened up vaccines to everyone 65 and older. And in the chaos that followed, some wealthy, as you know, wealthy hospital donors and those able to navigate a labyrinth of websites were able to secure shots when other people weren't. So, Governor Inslee, do you think that if the DOH had acted differently earlier, perhaps enlisting the National Guard sooner or waiting to open the vaccine up to everyone so there wouldn't be this free-for-all where some people gamed the system, that we wouldn't be in a situation where we have these inequities to fix now with philanthropic money?
No, that's just not the case. The inequities that we seek to fix, we are and have had some considerable success, as I indicated. And let me address this issue about inequities to date. A lot of people have compared, for instance, the Hispanic population is about 13%, and about 2.5% of the vaccines have gone to Hispanic folks. But that's not the comparison that is relevant here. The relevant comparison is the amount of percentage of vaccine Hispanic folks have received compared to the percentage of people who are Hispanic who are eligible. We're not going to make people eligible who are not eligible. So that figure is about 3.6%. So about 3.6% of the people who are eligible are Hispanic, and we have done about 2.5%. Not entirely equitable, but certainly not that far off. So the fact is we have had some success in this effort, but I want to repeat, we have had so much more to do, because as we get larger numbers of people who are eligible, we will have to increase our efforts. Now, our efforts have been significant to date. I've got a list of over 24 organizations that we're working with to do outreach to these communities. I think we've been very successful by using the National Guard, which I sort of directed the department to do, that it has been instrumental and very successful with these pop-up sites that are now doing, some of them 1,000, and they've told me they could ramp up to 2,000 a day. And we cited them in locations that would increase access to some BIPOC communities. So I do believe that we have done considerable work to try to, on this equity issue, and it is having some success. Now, you asked the question, could something have been done differently in a pandemic we've never experienced in the last 100 years? You bet. I'm sure that you could find things that could have been done differently. But I think that our state is responding with considerable success. We now, as I've said, are 14th or 15th in our rate of vaccinations. We're doing some good work on the equity front, and people are pulling together. Now, if you are telling 65-year-olds that they shouldn't get this vaccine, then be my guest. Everybody wants this vaccine. We have had to make priority decisions, and we've made them based on science. And the science is about 90% of the fatalities are people over the age of 65. And that is why we picked that level. Now, when we did that, we understood that there would be frustration of people trying to get this limited vaccine. But we thought it was better to try to save some lives, even though it might have involved some degree of frustration. Also, because we are increasing the supply of the vaccines, and that was a reasonable decision. And before I forget, thank goodness for the Washington National Guard. The work they have done has been absolutely fantastic, not only in this, but in helping feed people and working in food banks, providing security in an insecure time. They have just been wonderful. And I'm glad they're in partnership with the Department of Health.
Thank you, Governor. Our next question will come from Aaron Allen, Seattle Medium. Aaron, the floor is yours.
Good afternoon, everyone. Thank you for your time. My question is, several of the speakers, one of the major concerns is mobility, particularly for our senior citizens. How committed is this program and all those partners involved in this program? Are we taking advantage of of the transportation entities out there, Metro, that will be specifically designed to get people to pop-up sites or to clinics or to pharmacies and things of that nature? How committed are we with the mobility? Because I think that is if we're talking about getting people access, I think that's probably more with a high priority. And that's for anyone who can answer that question.
I'll take a shot at that. That's a great question. And in Seattle and King County, we're absolutely committed. And we have recognized early on that mobility was a big barrier. It's one reason we've had these pop-up clinics at adult family homes, at senior centers, at our low-income housing. But we're also rolling it into some of our community centers. This last week, we did something for the Central Area Senior Center at First AME Church. And with that organization, tried to make sure that there was transportation for people to get there. We have a pretty robust King County Metro working with Seattle, pretty robust shuttle system for some of our senior centers, particularly in Chinatown and International District. So we're really, when we plan these clinics, we want to make sure people can get to them. And so I think all of this is augmenting together. I want to go back to a question too that Essex asked that is related to this when he said, you know, isn't this the role of government? Why do you need philanthropy? I don't disagree with anything Dow said about that, but I go back to what the Reverend said at the beginning of this. We won't get through this if we're not all in it together. We need business, government, philanthropy, community-based organizations, all of us getting through this. We didn't make it this far without that kind of all-in effort. It was individuals making choices to keep them and their neighbors safe. They kept us the most safe. That's why we have to, until we get vaccinations, continue to wear masks, continue to social distance, continue to do those things. And if we're intentional, we can make sure that we do get shots in arms, but we get those in the Black and brown arms that need them and have been so disproportionately impacted by this. And so mobility is a very important thing. Language barriers are good. And I also want to echo what was one other thing that was said, and that is, not surprising, I don't have too many good things to say about the last president's efforts in any of these fields, but his unrelenting campaign against immigrants and refugees and our BIPOC communities left us with a resiliency we might not have had, and we saw that around the census, because we knew we couldn't get people counted and reach out to people if it wasn't trusted messengers coming to them in the language that they speak, that they knew. And this program is going to be able to utilize some of those same models. So I just want to say is, again, I'm so thankful that this endeavor's here, for all the community-based organizations who are willing to partner across the state, for the business and philanthropy who are willing to give, and for all the government entities that will back them up. Because only by doing that together are we going to get through this and beat this virus.
If I may, thank you, Mayor. If I may add on, the 2 mass vaccine sites that we opened, one in Kent and one in Auburn. The Kent site was cited there specifically because it is on transit lines, and the Auburn site cited where it is because it is well suited for drive-through. So we're trying to accommodate people, to meet them where they are, to accommodate them in the way that works for them. And the mayor mentioned the mobile vaccine teams. We are going to play to the people who cannot travel, who cannot get to a site where vaccines are being offered. I just wanted to emphasize one thing that the mayor said. She talked about people working together to get the community through this. This community in which she and I are serving has really done remarkable work as individuals and organizations pulling together to prevent the spread of the virus. And even though we were the first place in the country to have a major outbreak, we have had the lowest rate of infection of any metropolitan region in the country, save one, that being the Honolulu, Oahu area. So we're really proud of the way folks have stepped up to protect not just themselves, but their neighbors. And that same spirit has to carry us through the final leg of this journey till we beat this pandemic? Thank you.
Thank you for that question on transportation. I like to share the perspective of a rural area. I'm in Okanagan County, where public transportation is pretty limited. So we are leveraging that to the extent that it's available, but we're also ramping up to have mobile clinics and other mechanisms to facilitate access to the vaccine, especially as we move into the next phases. So mobile clinics, but also the personnel to be able to do the pre-registration and have the follow-ups that are necessary for the second dose. That takes a lot of manpower, a lot of coordination, and those are the areas that we need to continue to attend to. And these resources, I think, are going to help address those gaps.
Add something too. Look, on transportation and everything else, we are learning as we go in this process. It's one of the reasons why we've been so successful in Washington. We have constantly improved what we're doing. We're going to make improvements in transportation. And because we are committed to constant improvement, it's one of the reasons we are better than 45 other states as far as their infection rates, or 46. It's one of the reasons we have saved thousands of lives. Arizona has the same population as Washington, very close. They have had 10,000 more of their citizens die than the state of Washington. And part of those reasons is because we have learned and responded to the science of what we've learned. Now, in this process of building this vaccine system, we have learned some things. We have learned that we can't allow hospitals to allow vaccines to sit on the shelf. We need to encourage them to get them in people's arms. Hospitals have learned that when they ask for second doses and the state gives them second doses, they need to use it for second doses, not first doses, because when they do that, it disrupts the supply chain as it has the last week or so. We have learned about how to do outreach to areas, to reach, for instance, Hispanic folks without computer technology through a telephone to get an appointment. This is a constant learning process building this system, and I'm glad I'm in a state that can have a partnership between public and private to continue to make those improvements.
Thank you, Governor, and thank you, Aaron, for that question. Answers to that question have brought us right up to our hard stop here today. So if you have requested a question and we did not get to you, please note that I have your name written down and we will follow up with you afterwards. If anyone still has a question that they did not RSVP for or would like to follow up, please contact Arti Chandrakar. Her email is in your in the advisory that we sent out earlier today, and you can get in touch with Arti there. She also just added it into the chat, so thank you all. And with that, we are now concluding today's press conference. Thank you all for